What technology do I use in AMD treatment? Well, the first thing to say is that the treatment of AMD really starts out with making the diagnosis. So I need to see you in the clinic to really establish what the problem is, to establish whether you have AMD or not, and the specific type and indeed the severity of the problem itself. So that starts out with a consultation, and we put eye drops in to dilate the pupils and have a look at the back of the eye to examine your eyes in the initial instance. But after that we use advanced diagnostic technology and tools to further hone the diagnosis, and that really allows us to be very specific about your problem and indeed the severity. One of the techniques or technologies we use is called Optical Coherence Tomography imaging, or OCT imaging, and that technique really uses a modified camera system and uses the reflectivity of light from the back of the eye, from the retina where the light sensitive cells are, and that really allows us to build up a cross-sectional image of the back of your eye to a few thousandths of a millimeter detail, so highly specific and highly precise when it comes to making the diagnosis. Another tool or diagnostic technology we use is called fundus fluorescein angiography, and what that involves is injection of a fluorescent dye into your arm, and that allows us to visualize the blood vessels at the back of the eye and identify any points of leakage or bleeding, and that means that we can again target treatment to the appropriate problem. Fortunately, we're using that technology less, and we're able to make the diagnosis without any injection treatments into the arm using OCT imaging technology. And just the last point I really wanted to get across was that things are changing. We've seen a revolution in the way we manage people with wet age-related macular degeneration, not only in terms of treatment, but actually in terms of diagnosis. And one of the latest tools or devices or techniques we use is called OCT angiography. And this is particularly exciting because it means that we can visualize blood flow in the back of your eye, in the tiny capillaries and retinal vessels, using light, or the reflectivity of light. And it takes seconds to do, and just uses infrared light to scan across the retina in great detail. So a combination of these technologies or tools allows us to be very specific about your problem, and then allows us to tailor any treatment to the severity of the condition. The standard of care when it comes to making a diagnosis of age-related macular degeneration involves some of the tests that I've discussed with you. But I go above and beyond that in terms of making a particularly precise diagnosis, and that allows me to be very precise and detailed, and to individualize the treatment plan based on the individual problem. And that means that I use a combination of OCT technology and indeed fluorescein angiography as and when needed. And increasingly I'm also using OCT angiography, this latest novel technology, where it can positively impact on your care.